Welcome back to another episode of the Emma International Deep Dive Podcast. I'm Eric.
And I'm Sarah. Thanks for joining us. Today, we're tackling a topic that no life sciences company ever wants to experience: receiving an FDA warning letter. More importantly, we're talking about what happens next and how organizations can rebuild compliance under pressure.
That's right. A warning letter can feel like a crisis, but it doesn't have to define the future of a company. We've seen organizations recover successfully, strengthen their quality systems, and even come out better than before.
That's really the difference. It comes down to how quickly they respond, how honestly they assess the situation, and whether they're willing to make meaningful improvements instead of temporary fixes.
Let's start with the basics. An FDA warning letter isn't the first step in an enforcement action. It usually follows an inspection where investigators identify significant violations of FDA regulations.
And it's important to understand that by the time a warning letter is issued, the FDA believes previous discussions or responses weren't sufficient. The agency expects prompt corrective action, and the company is now under much greater scrutiny.
That's why these letters carry so much weight. They're public, customers can see them, investors can see them, and they can significantly impact business operations.
They can delay product approvals, create challenges with business partnerships, affect customer confidence, and sometimes even lead to import alerts, product seizures, or consent decrees if issues aren't addressed.
One mistake we see fairly often is companies rushing to respond without understanding the root cause of the observations.
That's usually the first reaction. Everyone wants to update procedures or retrain employees because those actions can happen quickly.
On paper, that feels like progress because you can show that something was done. But if the underlying quality system isn't working, changing a document won't solve the problem. Maybe management oversight is lacking. Maybe investigations aren't effective. Maybe there's a culture where deviations aren't escalated appropriately. Those are systemic issues that require deeper corrective actions.
Agreed. FDA reviewers can usually recognize the difference between a company that's genuinely improving and one that's simply checking boxes.
That's why root cause analysis is such a critical part of remediation.
Absolutely. If you don't identify why something happened, you're likely to repeat it.
We've all heard the phrase fix the process, not just the problem. And that's exactly what FDA wants to see.
Let's say a company repeatedly misses environmental monitoring limits in a manufacturing area. The easy answer is retraining operators.
But what if the real issue is inadequate facility design, or equipment that's overdue for maintenance, or procedures that haven't been updated in years?
And until you solve the real problem, you're just treating symptoms.
That's where tools like the 5 Whys, fishbone diagrams, and data trending become valuable. They help organizations move beyond assumptions and identify what's really driving the issue.
Once root causes are identified, companies need a structured remediation plan.
And that plan should be much more than a checklist.
It needs priorities, timelines, ownership, measurable deliverables, documentation, and executive oversight.
I always tell clients that remediation is really a project management exercise combined with quality expertise.
I couldn't agree more. You're coordinating multiple departments, balancing ongoing operations, communicating with regulators, and making sure corrective actions remain effective over time.
One thing that often gets overlooked is documentation. If you make improvements but can't clearly demonstrate what was done and why, FDA may question whether the corrective actions were actually effective.
Let's talk about leadership, because this is where remediation efforts either succeed or struggle.
Absolutely. Quality can't fix a warning letter alone.
If leadership treats remediation as the quality department's problem, progress usually stalls.
Leadership has to provide resources, remove roadblocks, approve investments, and communicate that compliance is a company-wide priority.
It also sends a message to employees. When leadership is actively involved, people recognize that quality isn't optional. It's part of how the organization operates.
And FDA pays attention to executive involvement.
They absolutely do. During follow-up inspections, investigators often want to understand how management has changed its oversight and governance.
Let's walk through a realistic example.
Imagine a medical device manufacturer receives a warning letter because CAPA investigations are incomplete, complaint handling is inconsistent, and supplier controls are inadequate.
The first instinct might be to update procedures and retrain employees.
But after conducting a comprehensive assessment, the team discovers the real issues.
Their electronic quality management system wasn't configured correctly.
Supplier performance metrics weren't being reviewed consistently,
CAPA owners hadn't been trained on conducting thorough investigations.
and management reviews weren't identifying trends before they became major compliance risks.
Once those systemic issues are addressed, the organization isn't just responding to FDA observations. It's building a much stronger quality system that reduces the likelihood of future problems.
One thing I always emphasize is that remediation isn't the finish line.
That's right. Once FDA closes the warning letter, the work isn't over.
Sustainable compliance means continuously monitoring metrics, reviewing trends, auditing systems, and improving processes.
Inspection readiness should become part of everyday operations instead of something that happens every few years before an FDA visit.
The organizations that perform best build quality into everything they do. They're constantly looking for opportunities to improve instead of waiting for regulators to point out weaknesses.
This is also where experienced consultants can make a significant difference.
They really can. Internal teams are often balancing remediation while still managing production, development, audits, customer demands, and day-to-day responsibilities.
Bringing in outside experts provides an objective perspective and additional resources when time is critical.
Consultants can perform independent gap assessments, strengthen CAPA programs, support FDA responses, prepare teams for reinspection, and help ensure corrective actions remain sustainable long after the warning letter is resolved.
It's not about replacing the internal team, it's about giving them experienced support to accelerate recovery and reduce risk.
So, if there's one takeaway from today's discussion, it's this: an FDA warning letter is serious, but it doesn't have to define your organization.
With honest assessments, strong leadership, effective root cause analysis, and sustainable corrective actions, companies can rebuild trust with regulators and emerge with stronger quality systems than they had before.
Compliance isn't about perfection. It's about building systems that consistently identify problems, solve them effectively, and continue improving over time.
Well said.
Thanks for joining us for another episode of the Emma International Deep Dive Podcast.
If you enjoyed today's conversation, subscribe wherever you listen to podcasts. And don't forget to share this episode with your colleagues.
And if your organization is facing compliance challenges, preparing for an FDA inspection, or working through warning letter remediation, the experts at Emma International are here to help.
Thanks for listening, and we'll see you next time on the Emma International Deep Dive Podcast.